The first Ebola outbreak occurred in the Democratic of Congo, then known as Zaire, in a community near the Ebola River in 1976. There were 318 people affected and 280 deaths. The first person infected with the disease was village school headmaster Mabalo Lokela, who began displaying symptoms on August 26, 1976. Lokela had returned from a trip to northern Zaire. He was originally believed to have malaria. His symptoms continued to worsen, and he was admitted to Yambuku Mission Hospital on September 5th. Lokela died on September 8th, 14 days after he began displaying symptoms. Soon after Lokela's death, others who had been in contact with him also died, and people in the village of Yambuku began to panic. This led the country's Minister of Health, along with Zaire President Mobutu Sese Seko, to declare the entire region a quarantine zone. No one was permitted to enter or leave the area. Schools, businesses, and social organizations were closed. Researchers, including Peter Pyatt, one of the discoverers of Ebola, later arrived to assess the effects of the outbreak, observing that the whole region was in panic. Pyatt concluded that the Belgian nuns had started the epidemic by giving unnecessary vitamin injections to pregnant women, without sterilizing the 5 syringes and needles that they were using all day. The outbreak lasted 26 days, with the quarantine lasting 2 weeks. The closure of Yambuku Mission Hospital helped end the outbreak. However, the researchers found evidence that the rate of new cases decreased considerably even before the hospital closed. The decline of the outbreak most likely resulted from changes in the community's behaviors, such as altering traditional burial practices so that people could avoid catching the virus from dead patients, isolating patients, contact tracing, follow-up surveillance, and community education. Since 1976, 26 outbreaks of Ebola virus have occurred in 10 countries of Africa, including Sudan, Gabon, South Africa, Uganda, Guinea, Sierra Leone, and Liberia. Democratic Republic of Congo is the country with the highest number of outbreaks, 7, followed by Uganda with 5. All of these outbreaks have presented a high level of severity, with case fatality rate in the range of 25% to 90%. The most recent Ebola outbreak was the largest in history, affecting multiple countries in West Africa. It began in Guinea and then spread to Liberia, Sierra Leone, Senegal, United States, Spain, and United Kingdom. The largest outbreak is the ongoing epidemic in West Africa, centered in Guinea, Sierra Leone, and Liberia. As of April 15, 2015, this outbreak has 25,890 reported cases, resulting in 10,717 deaths. Ebola, officially known as Ebola hemorrhagic fever, is a severe disease caused by the Ebola virus. Early symptoms of Ebola can include fever, headache, joint and muscle aches, sore throat and weakness, diarrhea, vomiting, and stomach pain. In some cases, the disease causes rashes, red eyes, hiccups, and internal and external bleeding. Up to 90% of people who are infected with Ebola die from it. Humans are not the natural hosts of the Ebola virus, and it's believed that the first person in any outbreak became infected through contact with an infected animal. Animals that are reported to have spread the diseases to humans include chimpanzees, gorillas, forest antelopes, bats, and monkeys. The disease can spread from person to person through contact with blood, saliva, mucus, or other secretions. In the countries where Ebola has occurred, the disease is frequently spread in healthcare settings to workers who have had contact with patients and do not wear protective clothing or masks. There is currently no cure for Ebola, but 2 potential vaccines are undergoing evaluation.